Welcome. Today's topic, how to fix your bad posture in about 10 minutes a day from home.
So today we're going to cover the 4 best exercises to fix your posture at home that we as chiropractors give our patients to start working on that posture.
So I'm Dr. Dan, Dr. Pascal. We're here at Woods Chiropractic. So for us, as a combined kind of years of being being chiropractors, we've been about in practice for about 25 years, and the key thing with postures, we've seen definitely a decline in the posture. People's posture is getting worse and worse and worse. And it's not just the appearance of their posture, but the physical aspects of their posture, like rounded shoulders, forward head posture, headaches, neck issues, shoulder issues, and tingling and numbness down the arms. So everything's definitely getting worse. And now 80 to 90% of our patients that are coming in have some form of posture deformities.
And it's not just adults. It's not just 80 to 90% of our adult patient population. We're starting to get patients that are coming in younger and younger, early teens, 8, 9, 10-year-olds that are coming in with these types of postural problems and associated symptoms, neck pain, headaches at a very young age.
Yeah, and so for us, we're taking care of some patients that are, let's say, 40s and they're in their 40s, 50s, and 60s. And if we're already seeing them with neck issues and back issues, and they didn't grow up with iPads, right? They didn't grow up like this, right? So my concern is, imagine what our kids from today that are, in their teenage years, what will they look like now in 20, 30, 40 years from now if their posture issues just continues to get worse?
So if you're watching, if you're a parent, please watch this and then even use this while you're at home, while we're doing this social distancing thing. Take this time seriously to analyze your kids' postures, have a look at them and see if they're starting to suffer or have some of these issues, and you can get them to start doing these exercises at home while you have this time as a family. So if you're on the video right now, please like the video, love it, drop any comments. If you have questions or comments throughout, please leave them on the video and we'll make sure that we're going to address them either after the video or throughout individually. We'll answer all those questions and get to all the comments. So we appreciate anything that you put out there. And
let's get into it. So first of all, what is bad posture?
For sure, because we're going to tell you guys, postural exercises to fix it, but if you don't know what you're fixing, it doesn't help, right? So let's talk about just analyzing someone's posture, okay? So ideal posture, when we're looking at someone from the side, we could use the ear canal as a marker. So the little hole in the ear should line up with the center seam of the shirt here. So Dr. Dan's wearing a black shirt, so it's hard to see that seam, but right now his ear is in line with the center seam of the shirt. That's proper ear to shoulder position. Now, in a perfect world, that shoulder sits directly over top of the center of the hip. And we can't see the center of his hip here, but just imagine center over the center of the shoulder over the center of the hip. Now, what we see in society at large, a very big problem is the head starts to drift forward. So the head starts to lean and shift forward. With every inch that head shifts forward, or every 10 degrees of neck flexion, it effectively doubles the weight of the skull on the spine. Okay, so that starts to lead to problems like tension throughout the shoulders and the neck. It leads to things like muscle spasms, neck pain, headaches. It could be numbness and tingling down the arms, shoulder pain. Okay. The other problem that this causes is it takes away the natural or normal position of the neck. So let's go back to good posture for a second, Dr. Dan. In this position, and you can see it here on Dr. Dan, there's supposed to be this natural C-shaped arc or C-shaped curve in the neck. That's the proper position for the health of the joints, the spine, the soft tissues, the ligaments. And as the head then goes ahead and drifts forward, we lose that curve and the neck straightens out. And that's going to lead to some stress and strain to the tissues of the spine, and the longer it stays there, it can become sort of a permanent deformity of your spine.
Yep.
And lead to permanent problems. Okay? So now the next issue that we see is the shoulders start to round forward. So the head goes forward and the shoulders round forward. So these are the kinds of things that you're looking at, and obviously this is an exaggerated posture, but this is what we see. Okay? So it's forward and rounded or forward and flexed. So all the exercises that we're going to show you guys to undo this type of posture are going to be an extension and external rotation. Okay? Exercise number 1, the Bruegger relief position. So what Dr. Dan is doing here is, imagine if my fingers were between his shoulder blades. He's trying to squeeze my fingers with his shoulder blades. Right? He's going to hold this position for 3 to 4 seconds and then relax. So his shoulders squeeze back. You notice his arms are opening up towards the front. He's getting a big stretch throughout the front of the chest. The head looks up into the sky and then relax. Right? So you're going to repeat this exercise with 3 to 4 second contractions or holds, and you're going to repeat this for 2 sets of 10 or 20 repetitions total, okay? A good thing that you can do, especially for breathing and stress relief, is to follow your breath. So you could do this on an inhale and then exhale, relax. Inhale, exhale, relax. Exercise number 2. This is a very challenging exercise, and I absolutely love this one because it works the entire posterior spine. So you guys can't see his knees here, but Dr. Dan has a slight bend in his knees. From there, he's leaning forward, or what we call hinging at the hips. You notice he's not rounding because he has that natural arch, that natural lumbar lordosis is kept. His head is slightly retracted or behind the shoulder seam, right? And now what he's going to do is he's going to lift his arms up, and he's going to try and lift his arms up, and you can see it till they get in line with that ear canal. He's going to hold that if he can for 20 to 30 seconds, and then he would relax and repeat that 2 to 3 times. And that is a very, very challenging exercise, as I'm sure as Dr. Dan lets go this one, he'll tell you he's probably feeling this everywhere from shoulders down to low back and hamstrings.
So feeling it especially lower back, middle back, right between the shoulder blades and all the back of the shoulders. And this is typically where we are very weak, especially with this kind of sustained computer posture most of the day.
Absolutely. So it's a good exercise to strengthen those posterior muscles. The next exercise. So now we're going to go to the wall. Okay. So this one here is called the wall angel. You may be familiar with this exercise. Tons of people have heard of it, but a lot of people do it incorrectly because maybe we're not taught properly. So we're going to go through the steps that you need to take here to make sure this is done correctly. Yep. So first things, we are going to have 3 points of contact to start: pelvis or low back, shoulders or rib cage, and then head. So those are your 3 points of contact to start with. Getting your head back once your shoulders and low back are touching might already be really challenging for you, and that's okay. So that could be your starting point. The first goal is to get the head back to the wall. Once you can get the head back to the wall, point of contact number 4, bringing the elbows back. Point of contact number 5, he's going to rotate his hands up until his hands are touching the wall. So now we have 5 points of contact: low back, shoulders, head, elbows, and wrists or fingers. Those points of contact need to maintain or need to sustain contact with the wall throughout this motion. So once you have that, Dr. Dan, go ahead, start sliding your hands up the wall. So he's going to push his hands up to the ceiling as high as he can go until he can't go any higher. Now that's going to be a little bit different for everybody depending on your flexibility. But what tells you, or what's your limiting factor, is once your arms feel like they need to come off the wall to get any higher, that's where you stop. So you repeat that 10 times, so up and down, for 2 sets of 10, for a total of 20 repetitions.
Yeah. And what is a lot of times hard for people is the flexibility in the front part of the rib cage. So sometimes you could get this, but then now the hands can't physically go back. And sometimes this would be the only start for you, is just physically working your way until you could get your hands all the way back to the wall.
Absolutely. Okay. So that there's the wall angel, and that's how we do it or address it properly. Now we're gonna show you guys an exercise that we call the Titanic. And the reason we call it the Titanic is because if you've seen the movie and you know the scene where Leonardo DiCaprio is on the front of the ship, he's doing this beautiful postural exercise whether you know it or not. And it's a great way to teach patients because they get the reference and they laugh, and it sort of ingrains this into your mind. Okay, so you need a shoebox, you need a yoga block, or a rectangular object that you have at home to put behind your shoulder blades. So we're going to put this behind Dr. Dan's shoulders. He's going to step backwards till he's touching the box. Okay, now there's a space between his head and the wall, and there's a space between his low back and the wall. So he's going to start by pushing his hips back towards the wall. Okay, that's going to drive the chest forward. Now he's going to try and bring his head backwards to touch the wall if he can, right? And now he's going to perform sort of the same idea or the same exercise as the Bruegger relief. He squeezes his shoulder blades back. He's bringing his hands back until his hands are touching the wall. And he's going to hold that for 3 to 4 seconds and relax. And the same protocol for these postural exercises. You hold it for 3 to 4 seconds and you relax. And we'd like you to repeat this for 2 sets of 10 or 20 total repetitions. Okay? So far, just a quick recap. We've shown you guys 4 exercises. The first one was the Bruegger relief position. The second one was the hip hinge with the arms straight up to your side. The third one was the wall angel. And the fourth one was called the Titanic. A little bonus exercise for our patients. So if you're a patient here in our office, once we are back to normal operations and we're seeing our maintenance and corrective care patients regularly, this is an exercise that you can do here in the office after you've had your adjustment. So this here is a fantastic way to get the head back and to help increase that cervical curve that we were talking about. Okay, so Dr. Dan's going to go ahead and he's going to show us how to do this here. So you're seeing his arms are coming forward, and that puts tension on the band, and that creates this fulcrum for his neck to then be able to bend back against. So it's creating a fulcrum for him to be able to increase that neck curve and drive his head back. So he's going to repeat that again, 2 sets of 10, and each time he's doing that, he's holding it for about 3 to 4 seconds, and then he relaxes. Okay, so fantastic exercise to improve your neck curve, your posture, and take strain off of those tissues. So our existing patients, again, in the interim, since we're not technically open for another 2 weeks to the public, if you want one of these neck exercisers, just reach out to us. We have them here in the office, and we can make sure we get you one so that you can work on this while you're at home.
Right. So basically, all of these exercises address the 3 main kind of issues with bad posture. Number 1 is kind of too tight of a forward, kind of front part of the shoulder, front part of the chest, weak back muscles, and obviously the head going forward. So all those 3 exercises, basically we want to open up the front part of the chest, drive those shoulders back, bring the head back. So those are the key things that we want to do to kind of change and correct your posture. And these, again, it's about simple to do, 10 minutes a day, and just it's a little bit of a habit whether you do it first thing in the morning before you go to work or during work. These are simple things that you could do during the day.
And you don't have to do all of them at once. So we showed you 4, 5 exercises that you can do. And if you want to do all of them, great. But simply just implementing, pick one of them, your favorite one. And if you're working at home right now because maybe you're not going into the office, just choose every half an hour, every hour, get up and perform 2 or 3 repetitions of one of those exercises. So even just doing a little bit is just a great step forward in the right direction. So
absolutely.
Again, post your comments, questions, anything that you would like us to review or describe in further detail, leave your name and we'll get in touch with you there and make sure that we get you that information.
Yep. The other thing is on Thursday, we're going to do another Facebook Live at 3 p.m. And again, our goal is while we have this time and while you have this time is to use this time, effectively by helping you to, or teaching you or showing you different things that you could do at home. So on Thursday, we definitely have a few ideas, and if you can leave your ideas in terms of what topics that you would like us to cover, we've had ideas of in terms of sleeping positions, sciatica relief, what you can do from home, nutrition guidelines, what could we do to increase our immune system with foods from home, in terms of what's the setup that we should look like, or ergonomic setup with while you're probably working from the kitchen table or on your island. What can you do to help your posture while you're working from home?
Flexibility, mobility are some of the other options that we had too. So doing some shoulder flexibility work, doing some low back, some hip flexibility work. So a bunch of different options there.
Yeah.
And then last week we also did a Facebook Live. So check out our video on the exercises that bulletproof and strengthen your core and low back.
So bottom line, we're here to help. We're going to get through this. We're going to be okay. If you have questions, especially reach out to us, info@lindenwoodschiropractic.com. We'll do anything we can to help. Also, we also have the health or telehealth that we could also do, whether it's a video call or a call from home. Anything, again, we're here to help any way we can.
So thanks for being on the Facebook Live, and we'll look forward to seeing you guys this Thursday at 3 p.m.
Have a beautiful day.